Hi, in my first video, Message to Peter Harvey, I have mentioned about vitamins infusions that I have been receiving with my chemotherapy. I'm sure that vitamins help me a lot with going through chemo. In the first interview with oncologists, I have been told not what benefits chemo will give me or if I get any benefits from chemo, because nobody knows. But what side effects I may expect to have? There was some. I will not go through this because every chemo is different and there are different side effects. I will tell you my reaction to the chemo I had. My chemo was very strong. I had to go to hospital for 1 day to receive chemo intravenously. That day started at 8 a.m. and lasted until I measured amount of water and chemo that was injected in my veins. So I stay in the hospital all day. I have seen people coming before lunch, receiving chemo, then leaving. Then another group of people coming and receiving chemo, and I was there till end of the day, 5 p.m. Then at home I was taking chemo, 5 tablets a day for 3 weeks. That was one cycle, and I had 6 cycles like that. Altogether I had till now 15 cycles. They were all different, but still chemo. I'm still on the chemo now. With that chemo, I have been given some other medicine to reduce side effects, which I have taken as instructed. Next day, I had vitamin infusion and I had continued taking chemo, 5 tablets a day and vitamin infusion every 3 days. First couple weeks after I started taking chemo was incredible experience, something that no doctor will tell you. Maybe because this changed from person to person. Everybody is individual, I think. All doctors may don't know about it, or it was only my reaction to this chemo. In first few days I have developed strange sense of smell. My nose goes so sensitive that I could be in backyard, and if anybody opened fridge door in the house, I would smell food that was in it. If that smell wasn't good for me, I would feel like to go and vomit. The same happened to my taste. It was so sensitive that something that before would taste normal, salty, sweet or spicy, this time was accelerated many times. This became torture. First I smell food. If smell was okay, then I taste it. It was terrible experience for my wife and my mother-in-law. It was so hard on them and me. Every time I had to overcome this smell and taste. It was constant battle for eating food. Water tastes so bad I had to fight with myself to drink it. I went through hell and back forcing myself to eat and drink. I was also getting very weak, but after vitamin infusions I felt much better and stronger. I ended up eating soups only, made out of pickled cucumbers, beetroot soup, chicken soup, pumpkin soup, and mostly sauerkraut soup. When I had eggs for breakfast, I could tell you if egg was coming from chicken fed by pellets or free range. I could taste all chemicals in it. It was so hard to eat anything, but to have strength and be able to fight the cancer, I had to force myself. Then, in the first week, came pain in my liver. In that time of diagnosing my cancer, I had tumor in my liver 7 by 6 centimeters. It was as big as tennis ball. I had cancer in other parts of the body as well. But this one in my liver was attacked by chemo first. Pain was so severe, I had to get painkillers that had to be approved by authorities before doctor could prescribe them to me. It was so painful. Likely it lasts a week or so and it was gone. At the same time, my vitamin doctor, who was giving me vitamin infusion, checked my blood and made some vitamins to be on the higher level by giving me extra injections of vitamin D, B and iron. He said to me, our brain is the best chemical factory and it needs vitamins to make me stronger in the fight of my cancer. Because my sickness was, and it is, diagnosed as terminal illness, there is no cure for my type of cancer. I have to be aware that taking vitamins infusion and every so often chemo is going to be part of my life. I hope that I will be able to live longer than doctors have experienced with my type of cancer. That's why I'm taking chemo and vitamins infusion with it. So far, I have lived longer than average person with my cancer. Doctors don't want to talk about vitamins infusion that I have mentioned, and I have been taking with my chemo. They simply don't believe in it. This is why I'm making this video, to make people aware of vitamins that I'm taking with my chemo treatment. Not to discourage people to the chemotherapy, but make authorities aware that maybe these vitamins together with chemotherapy have better fighting property than chemo by itself. I have every reason to ask this question because I went through it. I'm still going through. I'm here to tell you what I'm going through, so please hear me. I also have made important decision on the day when I was diagnosed with cancer. Decision about my diet, food and drink that I have been consuming and how it could contribute to my cancer. I had to change my eating habit for the reason that many people don't take it seriously, and I will explain it in next video. Thank you.